Good afternoon, and welcome to the Center for Healthy Sex monthly Sexpert webinar series. I'm Dr. Alexandra Katahakis, Clinical Director of the Center for Healthy Sex here in Los Angeles. And today you're in for a treat because you're going to be visiting with Dr. Crystal Hollenbeck, who's a licensed mental health counselor with offices in Orlando and Tampa, Florida. She has an accredited doctoral degree in counselor education and supervision, and she's a state qualified supervisor. But more importantly, Dr. Hollenbeck is a relationship expert. She's a ASEC certified sex therapist, and she's a certified sex addiction therapist, which is sort of a rare combination. So she brings perspective from both ends of the spectrum. And she specializes in helping individuals and couples address sexually related issues, including sexual intimacy, trauma, dysfunction, and addiction. And clearly, she's going to be talking today about issues around desire. She also offers 3-day intensives as well as in-office and telehealth sessions with a very caring and non-judgmental and solution-focused approach to healing and acquiring a healthy sexuality. So it's my pleasure to turn you over today to Dr. Crystal Hollenbeck.
Hi, Alex, and thank you so much. I'm so excited to be a part of this webinar series for the Center of Healthy Sex. And I have admired Alex and her team for many years, their passion and dedication to helping people in the area of healthy sexuality, as well as the great contributions that they've made to our field of sex therapy and sex addiction therapy. So thank you so much for having me. The topic that we're talking about today is sexless marriage, and I've prepared a PowerPoint presentation kind of with the information that we're going to discuss today so that might be helpful to you. At the end of the presentation, I want to give ample time for us to have a discussion together, to answer any of your questions. Maybe some of you have something you would like to share that could add to the discussion, but I am looking forward to us all learning together and talking about this important topic. If you have a question that you would like not to use your name for, perhaps, you can email Charlie. He's handling everything behind the scenes. Thank you, Charlie, for making sure we all go smooth here. You can email him at charlie@Center for Healthy Sex if you have any questions that we can also address at the end of the presentation. So again, I'm Crystal. So nice to be with you. And what we're going to be talking about is, first of all, why is sex so important in a marriage? We're going to cover 20 reasons that couples stop having sex. And we're then going to talk about how do you build and maintain a healthy sex life. First of all, why is sex so important? There are so many benefits to sex: physiological, psychological, spiritual, emotional. I mean, so many things. It helps increase our mood. It helps our complexion. It actually decreases heart disease. We live happier. We live longer when we're engaging in sex approximately 2 times a week. There's this bonding that takes place when we have sex, an emotional connection that takes place with our partner. It's also, for ladies especially, enjoy this, men too, but we burn calories, of course, because it is exercise. So it's so important for us in so many areas. For us, like I said, in all of these areas, and it's very important we look at from a healthy perspective that when you're in a marriage, we suggest that each of you initiate sexual activity at least once a week. Therefore, you're going to engage twice a week because, sometimes one of you will say no. Sometimes you get busy, that sort of thing. But we want to keep in mind that it might be unhealthy if you've gone an entire week and you haven't initiated some type of sexual activity with your partner. So why are couples not having sex? It's so important. There's so many reasons to have it. It's good for our overall well-being. It's great for our relationship. We live longer, all those great reasons. But what I see in my practice is couples will come into me and sometimes they know the reason. They'll come in, they'll be able to identify it, tell me what they're looking for help. But a lot of times they come in and they're not sure. Like, how did we get here? We're just not sure. So what I like everybody to keep in mind is it really is a complex issue. There are hundreds of reasons that we don't have sex or we stop having sex, and we're just going to touch on the 20 most common reasons today. But what I see is usually there's several things that contribute to us not engaging in sex. There's multiple reasons. Usually it's not just pinpointed at one. So the first one is an unconsummated marriage. This is actually when a couple have gotten married, but they've never had sexual intercourse yet. And we see that this is an issue with both physical and psychological issues that contribute to this. But this is a couple that would come in, and sometimes they've been married a short time, and sometimes I've seen couples that have been married several years and they've never actually had sexual intercourse. Another one, of course, a reason is we all get those unrealistic expectations. There's the Hollywood myth that we buy into about sex, that it's always going to be passionate and you're always going to smell good and look good and the timing is right and we have so much energy. And of course, we all know that that's not true. We have the Disney myth that we're just going to meet our Prince Charming and fall in love and we're going to live happily ever after. Although we never talk about sex in the Disney movies, we get this idea that we're just going to live happily ever after that first beautiful magical kiss. And of course, we know that's not true. A healthy relationship takes two people both making an effort in the relationship. It just doesn't happen automatically. And then there's the soulmate myth. A lot of times people buy into this idea that there's only one person for me. And we just know that that's not true. We can fall in love with more than one person. If your partner dies or you divorce, you can meet someone else. You can fall in love. You can have a wonderful sexual relationship with another partner. But sometimes coming into a marriage with these unrealistic expectations will contribute to couples not having sex. Of course, we all have a history that we bring into our relationship. A history of sexual abuse that has been untreated is definitely going to affect the sexual relationship. Oftentimes, the person who has been abused will have triggers that bring back memories of their abuse. And so it's very difficult for them to engage with their current partner. Trust could also be a factor with that. Our own sexual experiences. Our experiences are going to be different for each one of us, and those are going to impact our ideas about sex, their reasons for a lot of our habits for sexuality, our expectations, and then unhealthy beliefs from childhood. Some of them are kind of funny, and some of them are more serious. I know myself, I can remember that I was in chorus, and I must have been like in 8th grade, and there was a girl talking about sex. And she was telling all about how terrible it smelled. And she had to take a bath. And she was going on and on about the smell. Do you know, that kind of stuck with me. When I became an adult, I had this idea that it was going to smell really, really bad. A lack of sexual education. Again, sometimes in homes, it's just not talked about. I know myself growing up that I was not educated sexually. I think today we do such a better job of educating our children, of talking openly. But a lot of adults did not grow up with that same idea. I know myself, I could remember when I was little, I used to think in my mind, because we never talked about sex. And I used to think in my mind when I would see a couple and if they had 3 children, I would think, oh, they must have had sex 3 times because they had 3 children, right? So we think all kinds of things. But really we are harmed from a healthy sexual standpoint as we're developing sexually. If we never talk about it, if we never get help for our sexual abuse, if we're not able to learn from our experiences and feel open, a lot of times we can carry shame and other ideas that can be a reason that we stop having sex. or it impacts our sexual activity negatively. And then, of course, the next reason that would follow that would be religious beliefs. A lot of times, faith will teach that sex is a duty, it's something you have to do. That therefore, women especially won't look forward to it as much. You just don't talk about sex. All you do is practice abstinence, but there's no talking about sex, no talking about knowing your body. Sex is for procreation and not pleasure. That's a very common belief that I see with the couples that I treat. They have to really learn to give themselves permission that having sex is really pleasurable and that's okay. Also, certain sexual acts are sinful. This is what I see very common with masturbation, with oral sex. A lot of times people will think that those acts are sinful. So any type of religious beliefs that you bring in, they have to be talked about, sometimes overcome. Sometimes we've got to talk about their faith, perhaps talking to their pastor, talking as a couple together. But these impact your ability to have sex and your desire to have sex with your partner. Of course, the next one is poor communication. And every one of us probably understand that communication is the foundation for relationship. So we have unrealistic expectations, a lot of times a lack of assertiveness. So for example, maybe we're not having sex or we're experiencing some sexual problems and we get passive about it. We avoid it, we don't talk about it. Or we get aggressive. Maybe we make angry comments about it. Maybe we punish our partner in some way because we're hurt, because we're not having sex, but we don't know how to talk about it. Assertive is right in the middle. We're going to use I statements and say, I'd like to talk to you about this. This concerns me. Of course, using sarcasm in a relationship is never okay. It kills relational intimacy. Sarcasm is simply being mean and laughing about it. And we all know that it's never funny to be mean. But a lot of times that's a very common issue that I see with communication with couples. And then assumptions. We've all made assumptions. I'm not going to tell you this because this is how you're going to react. I'm not going to do this because you won't like it. So what we have to do is just talk through that, ask, share, but don't make those assumptions. Because it can really be a reason that you stop having sex. Somebody will feel like they're not heard. The lack of listening and validation is one of the most common issues. They'll say something to their partner, but it's ignored and they continue the same behavior sexually, or they continue not to do what they're asking for. So again, communication is really a very important reason that could impact the amount of sex that you have in your marriage. And then conflict, chronic arguing, abuse or neglect. You know, neglect is the worst form of abuse. Oftentimes I have couples that come to see me and their partner just never initiates sexual activity with them. Maybe their partner never notices them sexually, makes any compliments about them. They just feel emotionally disconnected. They feel neglected. And, you know, Mother Teresa said that neglect is the worst form of abuse. You know, not addressing the issue when it comes up, not giving your partner attention is one of the worst things that we can do for them. And then having different worldviews and different value systems. This is something very common as well. You see sex differently. You value sexuality differently. And the two of you really have to talk about what are our values. How do we keep boundaries to protect our value system, but yet also move forward as a couple to compromise where we both feel safe and loved and can engage in healthy sexuality? Unmanaged stress. Of course, we know that having sex is a great stress reducer. Oxytocin that's released, the exercise that takes place, feeling more connected and bonded sex is a great stress reliever. So when your stress is unmanaged, and you're not having sex, it really can impact your mood and your sense of well-being. And there's positive and negative stress. There could be good things happening, but maybe you're busy, maybe you have a lot of obligations. Having unhealthy coping skills, maybe overeating when you're stressed, maybe getting angry, talking nasty when you're stressed. Sometimes another unhealthy coping skill is when you avoid doing what you should do, procrastination shows up. And then poor self-care, you have no time for yourself. You're not taking very good care of yourself a lot of times when you're stressed, because taking care of you gets put down to the list at the bottom when you're busy especially. And then the lack of life balance. Enjoying each other sexually, you really can't lose your individuality. So I always recommend that couples have their own individual hobbies that they do, friends that they get with. They do things with their partner. They practice their faith. They spend time with family. So you want to make sure you have balance in your life because I hear this a lot with couples that I see who are not having sex. Their life in general is not balanced. The next reason is hygiene, body odor, poor dental hygiene, ungroomed hair. The ungroomed hair could be maybe you don't get your hair cut or kept well. Maybe you just, for men, that would show up for facial hair perhaps that's not groomed well. Maybe for women, not shaving their underarms or their legs, keeping their vaginal area groomed well. So these are things that really can affect your partner's desire to have sex with you. It also affects how you feel about yourself. When we have poor hygiene, we don't feel as good about ourselves. There's research that shows the more we take care of ourselves, the more active sexually we are, simply because you're just feeling better about yourself. The next reason would be the loss of attraction. Of course, hygiene could cause a loss of attraction, a weight gain or a weight loss. Right now, for example, I have a couple that I'm seeing and she's just lost 25 pounds and she feels great. And her husband says that he's not attracted to her since she has lost the weight, that he wants her to put some more weight on. He thinks she's too skinny. And of course, she's struggling to say, wow, I really feel good about myself right now. So any type of change in your physical appearance and your weight could affect how often you're having sex. And then, of course, aging and body image. Every person that I talk to or know is going to have some body image issues as we age. And that is normal and healthy. But when it impacts having sex with your partner, you start to avoid social activities or allowing your partner to touch certain parts of your body. You're not feeling as comfortable in your own skin. You start to talk negative about yourself, see yourself in a negative light. That can really be a reason that impacts the amount of sex that you have with your partner. There's research that shows that the most important aspect that men are attracted to in a woman sexually is actually confidence, a sense of confidence. So, and of course, we know as women that we like to see confidence in a man as well. So if you have a negative self-image or you're dealing with some body image issues, that could definitely affect the amount of sex that you're having. The next reason is pregnancy-related issues. Now, this covers quite a few here. There's the fear of pregnancy. I've met with a lot of people that are hesitant because they're afraid their partner will get pregnant. This happens sometimes when they're trying to work with birth control, or maybe they've already had a pregnancy while they've been on birth control. And so it can be very fearful for a man especially. And then, of course, during pregnancy, again, we bring those belief systems into our adulthood of maybe you shouldn't have sex when you're pregnant or you'll harm the baby, or just not feeling attractive during pregnancy or not being attracted to your partner is a very common issue. Infertility can impact it as well. You would think, well, if we're infertile, we're trying to get pregnant, so we're going to have more sex. But what happens is, especially when you get your hopes up, and then you are disappointed. and you get your hopes up and you're disappointed. Also, the stress that comes with infertility treatments, kind of losing the romance a little bit, like, okay, we have to have sex right now, so we have to perform, right? So there's a lot of ways that it could impact your sexual activity in a negative way. And then, of course, a loss of a child as well. In fact, we know that the divorce rate is very high with couples who lose a child. And depression sets in a lot of times, anxiety, and that will impact your ability to be together sexually. Birth trauma and recovery, both for the woman and the man. Here's something that I have learned in my practice. I've seen probably 4 or 5 men now who are traumatized by watching the birth of their child. And it's very difficult for them to engage sexually with their wife after they see the birth. So this is something that we just work through. They are able to re-engage again, but it's something that is difficult to talk about, but it's something that's very real that happens. And then poor relational intimacy. We talk a lot about that word intimacy referring to sex, but actually sexual intimacy is just an extension of relational intimacy. Um, when you don't know your partner's love language, there's a great book called The Five Love Languages that you can get online, and they have a little quiz that you can take to tell you how do you receive love and how do you show love. So if your partner doesn't know that about you, a lot of times you're not going to feel very close to them relationally. And then, of course, we stop dating. I think this is one of the most damaging reasons that affect couples having sex is they are not making the relationship a priority. They don't have that special date time. They don't go out of their way like they did when they were dating for each other. So therefore, a lot of times it impacts how you feel wanted by your partner, noticed by your partner. We all want to be wanted and loved. And if we're not dating and not making the relationship a priority, oftentimes we just don't feel wanted. The next reason is betrayal. Any form of broken trust, lying, unkept promises, any type of secret behaviors or a secret life. Affairs, both emotional and physical. We know in our field of meeting with couples that affair recovery takes approximately 2 years, where trust is completely built back. So that definitely affects the sexual interaction in a couple. Now, trust can be built back, of course, but it does take some time. And then mental illness is a big factor in our sexuality. Anxiety is one of the most forms. I would say it's one of the most. Let me see how I can get my words here. Anxiety is probably one of the most prevalent reasons for treating sexual dysfunction because we get in our heads, so to speak, and so fears, anxiety, OCD, obsessive thoughts, all of that affects our sexual performance, our sexual desire. Depression as well, personality disorders. People with personality disorders, when it's untreated, they're very difficult to be around. They have problems with relationship dynamics to begin with. So if you're not aware that your partner has a literal disorder that needs treatment, you might have real adverse feelings toward them. You might be pulling away from them. You might become angry with them. So if you notice that your partner is pretty difficult just in general in relationships, I suggest that you go and see a therapist. She might or he might be able to get help for those personality disorders. And of course, any other mental illness undiagnosed is going to impact the relationship both inside the bedroom and outside the bedroom. So health-related issues, right? Just like our mental well-being affects our physical well-being and our mental well-being and our spiritual well-being all affect our sexual well-being. So physical illness and disease, chronic pain is a very common thing that I will see that affects a couple's sex life. Disability. Sometimes getting a disability, people get discouraged. How will they have a healthy sex life? And I want to encourage you that if you do become disabled in some way, you can still enjoy a healthy sex life with your partner. And there's lots of resources to help you do that. Having surgery, sometimes that's temporary, sometimes that is more long term, depending on the illness that you're addressing. And then sexually transmitted diseases as well can impact the amount of sex that you're having and how often. So, sexual dysfunction. It seems that about 43% of women and 31% of men will suffer with some type of sexual dysfunction within their lifetime. So we kind of put them into four different categories. There's desire disorders where you just really lack the desire or interest in sex. Arousal disorders is the inability to become physically aroused or excited during the actual sexual activity. So we see that there's differences there. The desire is kind of the emotional wanting part of it. The arousal is actually a little bit more physical for us. And then orgasmic disorders. About 10 to 15% of women have never had an orgasm. And then pain disorders would be pain during intercourse. Both men and women can suffer from dyspareunia, which is pain around intercourse. And then there's also a diagnosis called vaginismus. And this is where there is dysfunction trying to enter into the vagina. And so for men, we see them suffer with erectile dysfunction. And then also premature ejaculation, not being able to control when they're going to have their climax. So these are real diagnoses. When you see a therapist, there is treatment for them. Just like mental illness, there's also sexual dysfunction and sexual disorders, just like mental illness disorders. So medication is a big one. This is a very common issue that I see that impacts couples with their sexuality. Antidepressants, antihistamines, prescription pain medication, birth control pills, anti-seizure medication, anxiety management medication, and then vitamins and minerals. What I suggest to all of my clients is really get educated on the medication you're taking and then really take a look at the crossover between the natural supplements and the vitamins and minerals that you're taking with that medication, because we see that a lot of medications of interaction can really affect your libido. Okay, so the next reason would be addiction. Sex addiction, love addiction, pornography addiction, gambling, drug and alcohol addiction. When we look at sex addiction, what we're taking a look at there is when you're engaging in sexual activity that causes you harm to your life, but yet you continue to do it anyway. So you're getting these negative consequences, and yet you keep doing it. We also see that with love addiction and pornography addiction. There's an increased tolerance in it. Across all addictions, usually, gambling, drug and alcohol, we see maybe we were just having a glass of wine at dinner, then we started going out on weekends, then we start drinking at lunch. So there's an increased tolerance in the behaviors. With pornography, it might look like I start off looking at some magazines, and then I'm online, and then I'm just looking at free porn, and next I'm going to websites, and then meeting with prostitutes, and then so it can progress into other things as well. Gambling, you might start out with some lottery tickets, might start out going to Vegas once in a while, and then you find yourself on a regular basis needing to gamble, being online. I see this a lot with stocks and trading, where I can see people really are spending hours and hours and hours in an addiction mode. So when you're in an addiction, you really have to get sober to have healthy sexuality, regardless of what the addiction may be. And then also understand that addictions are really intimacy disorders. So they take you away from being intimate, from being present with your partner. So if there's an addiction present, either with yourself or with your partner, usually we really have to be treating that in order for you to have healthy sexuality. So grief is a very important reason to be mindful of around your sexuality. And we think of grief as a death of somebody that we love, but really, grief is about loss, a relationship loss, career loss, financial loss, the death of a loved one or a pet. We can experience all types of losses where we grieve. For example, when I'm treating trauma with a couple, a lot of times when you come from an abusive childhood, you really have to grieve the relationships of what you need them to be and accept that they're never going to be that. For example, with your mother, with your father. And then you can start to heal and go on and have healthy relationships. But there's often a grieving process when you have healing from trauma or difficult relationships. Fatigue is another reason, being overworked. Probably everybody experiences that at some time, either being overworked or overcommitted. I was a stay-at-home mom for many, many, many years, and now I own a business. And I will tell you, this is something I have to be very mindful of no matter what I'm doing. Being overworked, overcommitting to things, saying yes. You just have to say no and keep life balance. Otherwise, you're too tired to be with your partner. The lack of exercise, sleep, and a healthy diet is going to cause fatigue. Chronic fatigue issues. I have met with a lot of clients who suffer from Lyme's disease, fibromyalgia. The time of day can affect fatigue. One of the common things that we address with couples who aren't having sex is trying to figure out a time of day that they have more energy for sex. They can give more of themselves to it. And then, of course, we all know, those of us who are parenting or have friends that are parenting or have nieces and nephews running around, that they are certainly a lot of fun and we adore them dearly, but they can be exhausting sometimes. Different ages require different amounts of our time and our energy. And so these are all reasons that contribute to fatigue. But fatigue is probably one of the most common reasons that I see with all couples probably that are not having sex. So our last one, and then we're going to get to your questions, is money problems. A lot of research has shown that the number one reason couples actually divorce is money problems. Financial struggle, disagreements on how you spend your money, the lack of partnering. This is something very common that I see. There's separate finances, so it's yours and mine versus ours. So money will cause just this strife between you, that lack of intimacy between you, arguments, so many arguments over money. So what I do with couples is we take a look at how do we value money? How can we partner in this area? Partnering in all areas of your relationship, whether it's spiritual, parenting, partnering, household chores, all of those areas is very important, and it impacts the bonding and the intimacy that you have as a couple, and therefore is going to impact your sexuality. So that is our 20th reason. And now I want to take a minute and just talk about, now we've looked at a lot of reasons. So what do we do to build and maintain a healthy sex life in our marriage? You really have to begin with a conversation. And that sounds so simple, right? Let's talk about it. Well, every couple that I see, this is always an issue. Either they have tried to talk about it, but it ends up in an argument or sarcasm or hurt feelings, or they're afraid to talk to their partner because they don't want to hurt their feelings and it's a sensitive topic. So we have to be able to begin the conversation. Again, I recommend, like I said earlier, start with an I statement. Say, I'd like to talk to you about our sex life. I'd like to talk to you about our intimacy. Are you feeling the same way that I am? I want to share how I'm feeling with you. Could we work on this together? So together, try to identify the specific reasons. If you are unable to identify the reason and then re-engage sexually, then agree to seek help. really, as a couple, even if it's uncomfortable, it's embarrassing, sometimes it's shameful to have to go talk to a stranger about your sex life and your intimate details. But we are trained. We're here to help. And once you get comfortable with your therapist, she's not going to make you tell every nitty gritty when he or she first meets with you. They want you to feel comfortable. We understand that it's a sensitive topic, but we're here to help. So agree to seek help, because if you don't and you're not able to figure it out together, it really impacts the quality of your life. The first thing that I always recommend to couples when they're experiencing any sexual dysfunction or medical issues is to see your doctor before you come and see me, whether that would be a gynecologist, a urologist, your medical doctor to get a physical exam. But be sure that you want to rule out anything medically going on as well. Something like diabetes might be affecting your sexual dysfunction, and when you treat it, you're able to re-engage. Then seek counseling with a certified sex therapist. One of the mistakes that I've heard a lot of couples tell me they've made is they've actually gone to get help, excuse me, with a therapist who is a couples therapist, but they're not trained to deal with sexual issues. This can actually cause a couple more harm, especially when you're dealing with affair recovery and sex addiction issues. And then all sexual issues are a couple issue. Please keep that in mind as you're going forward together. Excuse me, I got a little tickle in my throat. But realize that whether your partner is struggling with something or you're struggling with something, that it's still affecting you as a couple. And so what you want to be able to do is really give each other that support, that empathy to say, we're going to face this together. We're going to work on this together. I'm going to be here for you and be supportive. And then make relational and sexual intimacy a priority. You have to make it a priority in your marriage because we get busy with our lives. And so if it's not a priority, it's very easy to put it at the end of our priority list. And when we have time, we'll do it. When we have energy, we'll do it. And of course, we know that that never works. So thank you so much for allowing me to walk through these. And here at the end, I've just put some reference article links for you if you'd like to look up some of the articles that have more information on some of these topics that I've discussed today. And now we're going to take a look at your questions. I'm looking forward to talking with you and answering any questions you may have, hearing any input that you would like to give or add to our conversation. So Sarah says, what about enmeshment? Is that a problem you see with couples who don't have sex as often as they want to? So Sarah, in talking about enmeshment, I'm going to go down here. I see, Sarah, you've made another post. Let me just see what else you have to say. So with enmeshment, if you're talking about enmeshment within the couple, oftentimes, usually what we see is that one or both partners are actually enmeshed with other people. So that might be a family member, it might be a friend, but that's usually where we see it being unhealthy enmeshment. They're too close and too clingy to someone else. And so instead of making themselves available to their partner in the way that they should and making that relationship the priority, absolutely being enmeshed with somebody else is a very common reason as well. Where I see it show up in the couples that I treat is the partner won't feel important. They won't feel wanted. They'll feel low on the priority list, and that impacts the sexuality. Also, when you're enmeshed with someone else, you're getting your needs met oftentimes from that relationship in a way that you should be getting your needs met from the relationship with your husband or wife. So Gary brings up a great aspect for this. Gary, you're saying maybe I missed it, but isn't the biological programming of the male mammal to get bored with the same female body perhaps the most common reason? And what are your recommendations for that? Agree with Patel. What else besides what Perel recommends? First of all, Esther Perel has done great work. Her book on monogamy, Monogamy in Captivity or Born in Captivity. I apologize, I can't remember, but Esther Perel has done a great work on this topic. And this is one reason. I don't know that it's the most important reason, but absolutely, the male does at times lose interest in the female. And I also see the female lose interest in the male. So from my perspective, I take a look at it as a holistic perspective and a complex issue. I don't think it's just one thing or another thing that impacts attraction, that impacts monogamy. I think, like we've talked today, there are so many reasons and so many different aspects that impact our relationship and our healthy sexuality with one another. When I recommend, to answer your question about how do I deal with that, every couple is an individual couple. And so I'm going to ask them from their perspective what's going on with them, learn what their ideas are, learn what their interactions and their history is. And then we're going to talk about how do we progress as a couple. And honestly, sometimes couples do not stay together. Sometimes couples make decisions to move into open relationships where they stay married, but they have other relationships sexually with people. Sometimes they enter into polyamory relationships. So there's a lot of different options and lifestyles that people may enter into, but that's an individual discussion per couple. There's not just one answer to your question. So I hope that helps, Gary, answer what you were asking there. So Brian has asked the question, should gay couples seek great sex therapists or does it matter? I think it absolutely matters. Couples, regardless of what your sexual orientation is, if you are a couple engaging in sexuality and you're having sexual issues, I definitely recommend you see a certified sex therapist. There are a lot of people that will specialize in, I specialize in marriage counseling, in relationship issues, in sex therapy. There are some therapists that specialize in treating same-sex marriages, same-sex couples. They're going to have more training and education to be able to help you. But absolutely, there's a lot of resources to help you that you would not get from your regular therapist. And when I say regular therapist, I just mean someone who is a very effective therapist, but maybe doesn't have the additional training and education and resources to offer you around sexual issues. But very important that all couples, regardless of what your orientation is, that you get help to have healthy sexuality. Thanks for the great question, Brian. So Stacy says, what about when one partner has a trauma history but is not ready to seek help? How do you nurture the relationship intimacy then? Well, Tracy, Stacy, I'm sorry, that's a great question, Stacy. This is something actually pretty common. Trauma recovery is so different for each individual. I do a lot of trauma work. I offer 3-day intensives for trauma healing. And what we find is if that partner is not ready to come to therapy, to address the issues, isn't ready to talk to it, what I'll usually do is I will meet with the partner who is ready to do therapy, and I will help them to be supportive of their partner right now, wherever they're at. So I help the partner to get healthy themselves, to be supportive of their partner, to have open communication. Oftentimes I'll ask that partner to come in, to invite the partner in with them after we've done some therapy for some time. We never want to push. We never want to push somebody because they might not be ready and it could traumatize them even more. But we do want to gently say, I'm concerned about you. I love you. I wonder if talking to somebody may help you. And I'm here to be supportive and helpful in any way that I can. These are great questions. So Jay says, for men addicted to pornography, how long does it take to reset their brain so that ED is no longer an issue? Well, that's a great question, Jay. Not all men that are struggling with porn addiction actually have ED problems. although some do. So if we see that it's correlated directly to that problem, there's a rule of thumb that we follow in sex addiction recovery. We ask you for that first 90 days of recovery to abstain from all sexual activity with yourself, with your partner, with anyone else. We want to begin the process of resetting those neurotransmitters in your brain. Once you usually stop the masturbating and watching porn, a lot of times you're going to see that the ED will clear up automatically by itself. But usually we like to ask you not to engage in any sexual activity for those first 90 days. What about painful sex as aging? Bernadine is asking, great question. Painful sex as you age is something that's very common. It might not be vaginismus. It could be related to hormonal changes. Usually we can see vaginal dryness as you age. So the first thing to do if you're experiencing it is go to your gynecologist or your gynecologist. Talk with her. Try some suggestions that she has first. Make sure your hormones are in balance. Make sure you're exercising, you're eating right, your diet is healthy. Those are the first things that we look at even in sex therapy. So if you came to me, those are the questions we're going to address first. What's your lifestyle look like? How are your hormones? And then get medically examined so that we can rule out anything there. Then we would go beyond that. There's some wonderful ways that you can use with different positions, different skills, engaging with each other. So you can go on and have a really healthy, fulfilling sex life even as you age. But these are very common issues as you age. Thanks so much for the question. Oh, I'm sorry. Brian is saying seek gay, not great therapist. So I misread that. You said great there in the earlier one. Brian, I do not necessarily think that you have to seek a therapist that has the same sexual orientation that you do. And here's my rule of thumb for that. What are you the most comfortable with? I have people that come to me every day and they sought me out for a certain reason. And sometimes I'm not going to be a good fit for somebody. There might be certain aspects they're looking for in a therapist that make them feel more comfortable. So I always tell my clients, you make sure that you're seeking a therapist based on, at least at the beginning, based on what you're comfortable with. And so, no, I do not think that because you are gay, you have to have a gay therapist. Not at all. Just as I don't think that if you're not gay, that you can't be helped by a therapist who is. And so, again, it goes to the training of the therapist, the modalities that they specialize in, sometimes their personality. I have people that come to me and they choose a therapist on the way they look. So whatever it is that makes you more comfortable to open up and get your own healing and help, that's what's important. Thank you for the great question. So we have just a few minutes left. I am so sorry. I'm going to try to answer all these questions as quickly as possible. Thank you all so much for listening today and being a part of this. This has been just such a blessing to me. So Mary Jane says, do some couples stop having sex but maintain relational intimacy? I would say no to that. I would say that couples that I see, they might get along, but usually when they're not having sex, they're usually living more as roommates. They might have some physical affection. And again, there might be couples that maybe they do have strong relational intimacy, but the one thing that you do with your partner that you don't do with anyone else is having sex. And so when that is missing, that's kind of what makes you step over from friendships or roommates or other relational dynamics that you might have with somebody. So I would say the answer to that is no. That doesn't mean they don't get along well and their life isn't enriched, but most couples, their relational intimacy is going to be poor in some way because they're not having sex. Great question, Mary Jane. Alicia says, thank you. You're so welcome, Alicia, and thank you so much for the questions. So Sarah is saying, how does a couple get back to having fun sex when they have close, intimate relationships? Well, I'll tell you what I do, and this is what your sex therapist will do. The sex therapist is going to give you lots of good ideas to bring fun into your sexual relationship. I have a lot of resources, suggestions, cards, ideas that I give people to start having fun. One of the ways to have fun is to play strip Scrabble. So think about the board games you have laying around. Most of us have a Scrabble board game, right? I know now we're playing it on our phone, and you can still play it on your phone if that's what you do. But pull out the Scrabble and have fun and play strip Scrabble. So every word you're choosing for the Scrabble game is sexual between the two of you or romantic. And then whoever gets the one with the most points, the other person has to take off a piece of clothing. So that's just one idea, but you can incorporate games and have fun, taking trips together, talking, laughing together, dressing up. But I have lots of ideas. Food oftentimes can be fun together, cooking together, eating together. So that's a great question. And again, your sex therapist will give you a lot of ideas to help with that, to help to get the fun back, so to speak. So Paul says, how long does it take to recover arousal after stopping antidepressants? Paul, that's such a great question, and I think it's different for every individual. It depends on what antidepressants you were taking, how long you were taking them, how they impacted you, if you've been able to address the depression in a healthy way, and you're feeling more balanced. It depends on your physical well-being, your age. But I would say it doesn't take that long. It doesn't take that long at all. But again, I can't give you an exact unless I was meeting you as an individual, but it does happen. So if you're doing all of the things, communicating in a healthy way, exercise, diet, being romantic, making the relationship a priority, all of that's going to help you to get back to sexual arousal if it's medicated related. Great question. Thank you. And then Brian is asking, how long do you wait for a partner who has been traumatized to seek help? I've tried support and been unsuccessful in even getting an agreement to see someone for 7 years. Well, I'm sorry to hear that because I know I give a lot of resources to the partners of people who have been traumatized because it does impact you. And Brian, what I would say to you is your well-being matters as well. And for whatever reason, when we stay in a relationship with somebody who's unhealthy and it continues to be unhealthy, you really have to say to them, I don't know how long I can stay in this relationship if you don't seek help. And that would be for anything: addiction, unhealed trauma, anger management, anxiety management. Unfortunately, it does take two people to make a marriage be healthy. And it takes two people to both make the effort in the relationship. I'm a strong believer in individual responsibility. So your partner has the responsibility for her own healing, and you are being supportive of her. So I can't answer how long, but I will tell you, if you're not already in therapy, please do talk to someone. They can guide you and help you to assess that for yourself and give you some resources and help you to get as healthy as possible. That's a tough situation to be in. And it's a great question. Thank you. And so Mary Jane just asked about ADHD meds impacting sexuality. Yes, because ADHD meds, depending again on what they are, they're going to impact they're going to impact the way you feel about yourself, your focus, if you're going off and using them temporarily. And so if you're noticing your partner is taking those medications, you will check in with your psychiatrist periodically and just report what's happening. They can adjust your medication. If you have to have the ADHD medication and you're noticing some struggles, keep communicating that to your psychiatrist. they will help you with that and adjust it, and it doesn't have to impact you negatively. There are ways to work around that so that you can manage your ADHD effectively as well as enjoy a healthy sex life. Thank you so much for all these questions. Thank you so much, Charlie, for all of your help navigating all of this. And of course, Alex, I just admire you so much and just appreciate getting to be a part of your webinar series. So thank you so much. I hope this has been helpful to you. Again, Charlie will be uploading this next week. And so thank you all so much. All of you that have chatted with me and those of you that have just participated by watching, I appreciate your time. I know it's valuable, and I hope you will be well and try to work toward engaging sexually with your partner twice a week. That would be you both initiating. And if you are having some issues or you find yourself in a sexless marriage, please talk about it. Start that conversation and then seek help. Thank you so much. Have a great afternoon.